Dear friends, it's my pleasure to invite you to the first Congress on Adult Cystic Fibrosis that will be held in Milano in September 5 to 6 this year, not 2019. This is a very important Congress, I think, because you know that the epidemiology of cystic fibrosis is changing. Most of the patients are now adults. About 60% of our patients affected by cystic fibrosis are now aged over 18, and it's very important to improve our knowledge, the knowledge of pulmonologists, but also of all the physicians and healthcare people working on cystic fibrosis on the management of adults. In the Congress, we will have the most important experts giving us the information and the knowledge that we need to improve our management of adults with cystic fibrosis, but also the patient association, and patient will be present at the Congress, having the possibility to explain to us the unmet needs of the patient. Adults are different from children. We need really to improve our knowledge. So this is a real great opportunity for all of us to improve our knowledge, to have a better management of our adult patient with cystic fibrosis.
I'm really keen to participate to the first Adult CF Congress, which will be held in Milan in September 2019. This would be the first international congress specifically focused on the management of adults with cystic fibrosis. I'm working in an adult CF center, so I really need to discuss with my colleagues the management of these patients and how we should improve our quality standards for this specific population of patients. A lot of challenges from both a clinical and a research point of view. A lot of things we need to discuss, and will be also happy to share my opinion with patients who will be there in Milan to participate in this Congress and to give their contribution to the development of strategies in order to improve quality of life outcomes in these specific population of patients.